All right, today we're going to be talking about the heart. Not only the heart, but its key structures, the pathway of blood through the heart and the periphery, the cardiac cycle, and heart failure. The heart is made up of four valves and four chambers. The chambers of the heart include the right atrium, which receives blood from the body, the right ventricle, which pumps blood to the lungs, the left atrium, which receives blood from the lungs, and the left ventricle, which pumps blood out of the body. Now for the valves, we have two separate sets of valves. And the first set is the atrioventricular valve, and this consists of the tricuspid and the mitral or bicuspid valves. And these separate the atrium from the ventricles. And on the right side, we're going to have the tricuspid valve, so the right atrium and the right ventricle are going to be separated by the tricuspid valve, and on the left side, we're going to have the left atrium and the left ventricle separated by the mitral or bicuspid valve. We also have semilunar valves, and these consist of the aortic and pulmonic valves. The aortic valve separates the aorta from the left ventricle, and the pulmonic valve separates the right ventricle from the pulmonary artery. The upper part of the heart is referred to as the base, while the lower part of the heart is referred to as the apex. There are three layers of the heart. We have the pericardium, and this consists of the epicardium, which is on the outside of the heart, the myocardium, which is the middle, and we have the endocardium, which is inside of the heart. We have different types of nodes. Now, nodes are going to be what cause the electrical impulses of the heart to fire. The most important one of all, we have the SA node, or the sinoatrial node. And this is referred to as the pacemaker of the heart, or the cardiac pacemaker. The SA node is located in the superior aspect of the right atrium. This causes the main electrical impulses of the heart. This electrical impulse contracts both the right and left atria. Electrical impulses then travel down the internodal tracts to the atrioventricular, or AV node. The AV node receives the impulses from the SA node and causes the ventricles to contract. We also have the atrioventricular bundle, or the bundle of His, spelled H-I-S, and this carries electrical signals from the AV node to the bundle branches. And the right and left bundle branches we have in our heart. The right bundle branch causes the right ventricle to contract, and the left bundle branch causes the left ventricle to contract. So right, left, left. Very simple. We also have Purkinje fibers in our heart. And Purkinje fibers are specialized cardiac muscle cells that conduct electrical impulses to allow for coordinated contraction of the valves of the heart. So this way, our heart is contracting all at once as one unit. We don't have one contraction, another contraction, and so on and so forth. So everything's contracting all at once. The atria contract together, the ventricles contract together. Excuse me. All right, now we've covered the structures of the heart, so we know what we're talking about a little bit here. Now I'm going to tell you about the path of blood as it travels through the heart and the periphery. So blood starts out, where I'm going to start blood is going to be in the systemic veins, which are located all over our body. And these systemic veins take blood to the superior and the inferior vena cava. From the superior and inferior vena cava, blood is going to go into the right atrium, and it's going to flow through the tricuspid valve into the right ventricle. From the right ventricle, blood is going to go through the pulmonic valve into the pulmonary arteries, and to the pulmonary arterioles, followed by our pulmonary capillaries. And in the pulmonary capillaries, this is where the deoxygenated blood that we're receiving through the veins and the right side of the heart is going to transition. It's going to get rid of our CO2 and gain oxygen inside of the lungs. And after blood is done with that, so the pulmonary artery is going to be the only artery in the body which has deoxygenated blood. Usually arteries have oxygenated blood, but this is the only one that does not have oxygen. So the pulmonary artery and pulmonary arterioles are deoxygenated, and that's where they get rid of CO2 in the pulmonary capillaries, and then they are reoxygenated red blood cells that travel through the pulmonary venules into the pulmonary vein, and this is also going to be the only vein where we have oxygen-rich blood in the body. From the pulmonary vein, the left atrium, pulmonary vein, blood is going to flow into the left atrium, and it's also going to flow through the bicuspid or mitral valve into the left ventricle. And the left ventricle is going to send blood through the aortic valve into the aorta, and then blood is going to flow into the systemic arteries, the systemic arterioles, the systemic capillaries, the systemic venules, and systemic veins, and then the whole process restarts. So blood really travels all over the body. Well, fun fact, on average, in the average person, the heart pumps 2,000 gallons of blood per day. And that's fascinating to me. It's a lot of blood. All right, now that we have talked about the pathway of the blood, let's talk about how it works, how it fires. So we have two phases. We have the systolic and diastolic phase of the heart. During the diastolic phase, this is when the left and right ventricles are depolarized or relaxed, and they're filling with blood from the left and the right the left and the right atriums. And these two ventricles, they fill simultaneously. And this occurs when pressure in the atriums is greater than the pressure from the ventricles. The higher atrial pressure causes the AV valves to open passively. When approximately 80% of blood is moved through the atria into the ventricles this way. The final 20% of blood is passed from the atrium to the ventricles via the atrial kick, which is the contraction of the atriums. The end of the diastolic phase is when blood has filled the ventricles. And the systolic phase this occurs when the ventricles contract. So when our heart pumps, when the ventricles are kicking blood out into the lungs and into the body, this is the systole. And this pressure is from the concentration of the ventricles. It causes our AV valves to close, and the closing of the AV valves presents backflow of the blood into the atriums. The pressure of the ventricular contraction also causes the semilunar valves to open, and blood is then ejected out of the left ventricle into the aorta, and from the right ventricle into the pulmonary arteries. As blood is ejected out of the ventricles, this causes the semilunar valves to close, which ends the systolic phase of the cardiac cycle, and then again begins the diastolic phase. So think about blood pressure. This is how I remember this. So blood pressure, we have your systolic, which is your higher number, over your lower number, which is your diastolic phase, diastolic pressure. So the diastole is when our ventricles are relaxed, they're filling with blood, and that is going to be the lowest pressure that our body is putting against our arteries. And then we have the systolic phase, which that's when the arteries kick blood out all throughout the body and into the lungs. And that is going to be the highest amount of pressure inside of the arteries. All right, now that we've talked about blood and the pathway that it travels, we're also going to be talking about heart failure. And there's two types of heart failure. We do have left-sided and right-sided, but at the end of the day, heart failure is heart failure. It's really rough. It's really sad to see. And left-sided heart failure is more common, and this happens when the left ventricle fails to pump the blood out of the left ventricle and into the body. This failure causes a backup of blood in the lungs. And some causes of left-sided heart failure are coronary artery disease, a myocardial infarction or a heart attack, hypertension, so high blood pressure, valvular heart disease, it's when our valves just don't work anymore, and abnormal heart rhythms can also cause this, and that could be because of our SA-AV nodes dysfunctioning. And some symptoms of left-sided heart failure consist of constant coughing, shortness of breath, waking up at night short of breath, or being unable to lay flat. And we may also see some edema, and that edema is going to be our pooling of blood in areas in the body, pooling of blood or fluid in areas of the body. And right-sided heart failure, which is not as common as left-sided, this occurs when the right ventricle is unable to eject blood out of the right ventricle into the lungs. And this causes a backup of blood in the body. Right-sided heart failure can actually be caused by left-sided heart failure. And the reason that left-sided heart failure causes right-sided heart failure is because blood is backed up in the left ventricle, which causes backup of blood in the left atrium and the lungs. And where does the right ventricle send blood? Into the lungs. So if we have these backups of blood because of left-sided heart failure, then we're eventually going to see right-sided heart failure as well. And some additional causes of right-sided heart failure are not only that left-sided heart failure, but high blood pressure in the lungs, COPD as well. Symptoms of right-sided heart failure, we're going to see edema in the lower extremities essentially. It's where that blood and that fluid's pooling. Essentially, think of it how gravity works from the bottom up. If left untreated, heart failure can lead to a cardiogenic shock, pathological hypertrophy of the left ventricle and right ventricle, abnormal heart rates and rhythms, and ultimately death, unfortunately. Some risk factors include chemotherapy, diabetes, obesity, sleep apnea, older age, and smoking. Some other things that can cause these types of heart failures are pulmonary embolism. It's when we throw a blood clot into our lungs. Thrombus, which is a blood clot that is attached inside of a vein. And these really aren't good things. And then another cool thing that I found was that the SA node. So again, this is the SA node. This is where we receive that electrical impulse which causes the heart to contract. The SA node fires 60 to 100 times, or there are 60 to 100 impulses from the SA node every minute. And that is our typical heart rate. What we would consider within normal range is 60 to 100 impulses, which cause 60 to 100 contractions per minute. If the SA node fails, then we're going to rely on our AV node, and the AV node is lower. That's about 40 to 60 impulses a minute. And if both the SA node and the AV node are failing, then we're going to rely on the bundle branches. And unfortunately for people that this happens to, that's only going to get about 20 to 40 impulses and contractions per minute. And if our SA node fails, you hear about people receiving a pacemaker. That's because their SA node is failing. So this has been my video on the heart. I really hope you enjoy it. I hope it's informative for you, and I hope that you got something out of it. Thank you for your time. Have a good day.